Hi guys, today we're talking about erectile dysfunction or impotence, whichever word you like to use. I'm Dr. Deji Daramola. I'm a Canadian-based family physician, and this is a problem that a lot of men suffer from but don't like talking about it. So I'll be talking about it today. Impotence or erectile dysfunction is the inability to achieve or maintain an erection that is sufficient for a satisfactory sexual performance. It is also the most common sexual problem that men have to deal with. It affects about a third of men according to some studies, and the chances that you are more likely to get erectile dysfunction is higher as you get older. It's also known to be a cause of intimate relationship problems, decreases the quality of life, and it lowers a man's self-esteem. It affects our ego, because for some reason men associate a lot of prestige and self-esteem to sexual performance. You need to see some of the movies depicting men in the 18th, 17th centuries, even some of the kings like Henry the Sixth, or the Fourth, and you need to see the kind of of pants that they made for him, and the shape of where his penis is supposed to occupy. Men kind of associate a lot of esteem to their ability to perform sexually. So when they can't, it can cause depression, it can affect intimate relationships, like I said earlier on. But more importantly, apart from the bravado and the ego, erectile dysfunction may be a sign of a bigger problem. It could be a sign of an underlying heart disease, like a heart attack coming, inverted commas, and it could be a financial drain too, because I know men invest heavily in aphrodisiacs, especially those who attach a lot of esteem to their ability to perform. And the reason why I said it could be an underlying a sign of an underlying heart disease is because when the vessels are clogged, the small vessels are likely to be clogged faster or earlier, and we achieve erection as men because there's free flow of blood into the penis. So if there's a problem with that in that department, erectile dysfunction or impotence might be one of the first signs. It is caused by several reasons. For example, psychological reasons like anxiety, depression. It can be caused by economic downturn. For example, I was discussing with Dr. Abiara in an earlier video that we made on IVF, in vitro fertilization, and we were talking about causes of infertility, and this actually came up when you have chronic stress, psychological stress, economic downturn, traffic stress, work stress. It can be a big problem, and this is one of the reasons why a lot of men have erectile dysfunction. It's not the only reason, but it's the first reason I'll be talking about. The psychological reasons, we a lot of times don't address them, and they're the easier ones to address, in my opinion, because if it's a psychological reason, it can be addressed. You just seeing a psychotherapist can solve that problem. And close to that is what we call situational erectile dysfunction. In these instances, the man does not have an erection with his partner, but if he's watching porn, or he's watching a video that has some porn content in it, or he's watching a magazine that has porn content in it, he gets an erection. But when he is with his partner, he doesn't have it. So this man, it could be that he's already cheating, or he has anxiety or depression or guilt, or history of sexual abuse, or marital or even relationship problems. So these are things that are psychological, that needs a psychological approach to. Not everything is medication. So that's one big cause of erectile dysfunction that I want to address. And anxiety, depression also, of course, if you're anxious, you're depressed, you're going to have a low libido. Guilt, like I said, rape victims, men also have been raped, so they still get raped. then that can affect the ability to perform later. Another thing I'll talk about is lack of exercise, obesity. This can lead to erectile dysfunction. So you want to exercise, keep fit, you want to lose that weight. We keep talking about the importance of maintaining a normal body mass index. Obesity causes a lot of problems, and this is just one of those problems. Another cause of erectile dysfunction is medications. A lot of erectile dysfunction is a side effect of medications that are used to treat illnesses like hypertension, diabetes, even medication for depression and anxiety is a big one. And then you have some antihistamines that we use to treat allergy. These ones also can cause it. Benzodiazepines, for example, like Valium, stuff like that, they also can cause erectile dysfunction. So medication is a second cause I want to talk about. We talked about the psychological causes, now medications. The third one would be chronic diseases. While it is true that many medications used to treat chronic diseases cause erectile dysfunction, chronic diseases themselves cause erectile dysfunction. For example, diabetes mellitus, either type 1, type 2, hypothyroidism, a lot of neurological diseases like Alzheimer's, Parkinson's disease, stroke, epilepsy, especially the temporal lobe epilepsy, brain injuries, spinal tumors, brain tumors. Many others are known to cause erectile dysfunction. So you have to rule out chronic diseases as a cause of the erectile dysfunction. And the other thing I want to talk about is that you have some things that are preventable. For example, cigarette smoking. This is an issue. It is known to, some studies have shown that this increases your risk of erectile dysfunction. High cholesterol, illicit drug use, like the abuse of cocaine, methamphetamines, possible causes of erectile dysfunction that can be prevented. So what do we do if we have erectile dysfunction as men? Well, I usually start with lifestyle changes. You reduce your stress. I talk about chronic stress in a lot of my videos. How chronic stress increases cortisol in your body. Cortisol causes infertility, can lead to erectile dysfunction as well. So you want to reduce chronic stress, and you have to have a strategy to deploy to attack and reduce this chronic stress. You exercise regularly, maintain a healthy weight, sort out your relationship problems, see a shrink, see a counselor. Just do something about it. Stress has to be dealt with, whatever it is. Write your stress out every day and throw it in the bin. Meditate, practice yoga, practice tai chi, deep breathing. Whatever you can do, please do. Stress is a big factor, and stress can be dealt with. So stress is one thing that we can do to avoid erectile dysfunction. Then the second thing is modify your medication. With the advice of your doctor, you want to get your chronic diseases like diabetes, high blood pressure under control. And then you also want to be in charge of your health. Take charge of your health. Know the medications you are using, know their side effects, and the ones that can cause erectile dysfunction, you want to avoid them in conjunction with your doctor. I'm always very happy when patients come up with me or come to me with things like, oh, what is this medication for? What are the side effects of this medication? It's a conversation I'm always happy to have, because it tells me that you want to be in charge and that you are in charge of, whatever it is that's going on with you. And then don't buy medications from the chemist and just use. This is a practice that is common in many developing countries. People have what they call blood tonic, or they just go to a quack chemist and just combine some medications for whatever they think is wrong with them. And if you do this, then you might just be taking medications that may have a side effect of erectile dysfunction. And then there are pills that we can use to treat erectile dysfunctions. Some popular brand names like Viagra, Cialis, Levita. These are brand names that are effective, but they are not for everyone. So before you pop those pills, make sure that you are not on any other medication that is a contraindication to you using those medications. For example, if you're on nitrates, so you cannot use Viagra or Cialis or Levita. So you want to use these pills with caution. You want to make sure that your doctor is in the know and that you can have a plan together. In a nutshell, erectile dysfunction or impotence is caused by many things. Try to find out why. Just don't pop pills, and if you have to pop a pill, make sure there are no contraindications to you doing that. All right, and I hope that helps.